Testing, testing, testing. Testing, testing, testing,
Go.
testing. Testing.
Start the show.
Start the show.
Oh, okay. Welcome to the In My Opinion show with co-host Henry Hatter and friends. Seen on the internet 24 hours a day, 7 days a week. To view this show, go to flinttalkradio.com and simply access the In My Opinion show. Before we start our show, I would like to mention the Great Lakes Women Conference on September the 22nd and 23rd. This is a leading conference for women business owners that stresses networking skills for success. Growing Stronger Together is the theme of the 9th Annual Great Lakes Women Business Conference at the Motor City Casino Hotel in Detroit, Michigan. This leading conference for women business owners focuses on the importance of networking and provides the inspiration, the connections, and business know-how women need to reach their goals for the future. For interviews and photos, contact First Media Group at phone number 1248-354-8705. Now, today we're going to continue the discussion on healthcare. We had a lively discussion in our previous taping. And again, we have a very distinguished audience, people on the platform. And that is, first of all, Richard Dix,
Thank
who
you.
is well known on this show. Thank you, Richard. And then we have Rick Wilson from Fenton, who is a very great commenter in healthcare. Now, I want to stop again. I want to just go back to where we were in the last show. What should the people know about healthcare in the trenches? Those are the patients. Those are the people without the funding, with inadequate insurance or no insurance at all. How would you request that they help in this healthcare debate and to help bring the resolution of discussions to a resolution? Fred, what's your thoughts?
Well, first off, there are absolutely people who are not in good financial condition that need some help. There's no doubt about that whatsoever. We have identified the vast majority of those folks with the Medicare, Medicaid, and SCHIP programs. Now we need those folks to step forward that feel that they are struggling to be able to, afford health care, and when they step forward to say they're struggling to afford health care, this is not just so they can afford their cable TV. This is not so they can afford to buy that 62-inch flat screen. This is not so they can have an unlimited minutes on their cell phone. These are folks that are actually hurting that we need to help. At the same time, we as a society have said that everyone has a responsibility if they are at a moderate income level, and basically we've said that income level is somewhere in the neighborhood of $35,000 to $40,000 a year annual income. Now we can walk around that figure a little bit, but in the previous segment, Mr. Dix kept talking about the 48 million people are uninsured in this country, and even President Obama ratcheted that right down to 30 million in his national speech because he took out, we thought there are 12 million illegals in this country. He thinks there are 18 million illegals in this country that Mr. Dix obviously believes we ought to cover with insurance, which I totally disagree with. Now, we can take that 30 million figures I mentioned last time around, and we get down again, we're talking 8 to 10 million folks. We need to help those folks. We need to come up with a modified program that has them assume some responsibility for the costs and the effectiveness of those programs. At the same time, we provide them with some assistance, a boost up, not a permanent boost, but a boost up, so that they can afford, to cover themselves. But to somehow say that we're 48 million people uninsured in this country is a totally false statement.
Well, if you're a patient
and you have a 62-inch television, you can keep it. You should watch it. If you have a phone with unlimited minutes, that's great. But what health care reform is really about is about you. It's about changing a system that has left 30 million in the hole. And I stand corrected on the 49 million. They've identified 30 million. But that's 30 million too many. And as it relates to the immigrants who illegally in this country, I am not in favor of this health care reform covering them. But I am not opposed to the individuals going into the hospital or visiting a physician to get the necessary treatment, because we certainly would want the swine flu epidemic to affect the rest of America, because we didn't at least treat the 12 or 19 million. As it relates to the reform, it's absolutely imperative. We're living in perilous times where we're seeing diseases, we're seeing more threats of viruses, we're seeing more patients in the hospital emergency. So when we think about healthcare reform, as we look at the patients out there, those of you who are listening or viewing, it's critical that you understand this is for you. This is for us. And for the Republicans, they're on the wrong side of history this time. It's unfortunate, but this is a history that some of them have had, that they voted against. They said that Medicare would be socialized medicine. They said that Medicaid would feed the poor. It would help the poor, and they're going to take out of their pockets. These are the same arguments that were being made then in 1934, 35. We need to understand that healthcare reform is vital to the recovery of the economy. If we do not recover in this economy, we're just destined, and all of us will fall into the cracks. Not just the Republicans, not the Democrats, not the independents, not just you, but all of us. So we need reform so that we can begin the actual recovery process in our economics.
Mr. Dix, one of the things that I would hope that we touch upon is that we need to reform from top to bottom and from bottom to top. And there's a responsibility that every American has to help that out. We need those people who are in the trenches, who get less than 200% below poverty in their income. We need them to help us out.
Sure.
We need to help. We need them to help come up with a resolve on how we reform this so that all Americans will have health care. If we don't have anything else, I agree with you that we should have health care. Let's take and divide. There's so much confusion with health care. Let's take and divide health care into two components. One is insurance. One is health care. Let me ask you, Fred, do all Americans have health care?
Every American has health care to one degree or another. It is not uniform. It is not necessarily the highest quality health care to every individual. But every individual will and can go to, a hospital emergency room and be taken care of. Now, you can say that's not health care, and that's a discussion, that you can have.
Stick to the point.
But basically, yes, every single person in this country has availability of some level of health care. Certainly, it's not the way we would like it to be, but they do have that.
But Mr. Dix, do you agree?
I strongly disagree that everyone does not have health care. And this is just another view from the Republican Party to paint the picture as everyone having health care. And if you want to use the facilities such as Hurley or McLaren or Genesis as your doctor, as your main way of being treated, then yeah, that would qualify as health care. But let's just look at the stability and security, the security of it.
But what we want to do is focus on the fact: do
Yeah.
all Americans have health?
All Americans do not have health care insurance, and
Not insurance. Well, insurance is a different component.
Okay.
Health care.
well, when you talk about health care,
Health care.
health care, number one, is a responsibility of the individual. It starts at home. It begins with caring for yourself. But when we can't care for ourselves, we should see a practitioner.
But I'm talking about the public health care system. Do
Sure.
all Americans have that?
No.
Okay.
No.
Now, what would happen if this gentleman just outside the door fell down the steps and broke his leg, and with no insurance? What would happen to that individual? Just right out in San Antonio.
Chances are that individual would probably go to one of the local hospitals.
Is that health care?
Well, that is a facility where they will receive treatment. Now, if
No.
you're asking me that treatment facility is a way of declaring that they have health care, then that's not an applicable argument, because it doesn't apply as having something similar to what I have. I have in my pocket Blue Cross card, so I have health care. Yes, I can go to Hurley.
No, you have insurance.
I have
Yeah,
insurance.
there's a difference.
Okay, when you say health care, are you defining it as having accessible health care? Because that makes a difference. If you're saying, do we have accessible health care? Now, that's the question. Absolutely, we have accessible health care.
Okay, now, and that's the point that confuses this whole part of the confusion
Sure.
to the healthcare debate system. All Americans have healthcare.
Accessible health care.
Yeah, and
yeah.
we don't want to confuse
No.
the debate by saying that that's a system that we want Americans to have. That's just the system that does exist as a basic for every American.
We have accessible health care, and it's accessible to, and in fact, we have jobs are accessible, but do individuals have them? Cars are accessible, but do individuals have them? And so when you say, do you have health care, are you asking, is it accessible? And the question is valid, that yes, it is accessible, but do you have insurance to afford it? And that's a whole different degree of arguing.
And that's what has skewed the debate on healthcare.
Very good, very good.
Now, let me just continue with this. Now, I think that any individual in this studio who had a problem, got sick, and began vomiting or whatever, had no insurance.
They would have accessibility.
They would have health care.
Accessibility.
Now, would you like to be treated in Mexico, Canada, or Europe,
Absolutely.
South America?
Absolutely.
You would rather-
Wherever
than-
I
than
am,
the United
I would
States?
want to be treated.
No, I'm talking about where would you most likely like to be treated?
Wherever
I mean,
there's accessibility.
in the United States, or
Wherever there's
where would
accessibility.
you like to be treated?
Having lived overseas for 4 years, having visited South America for weeks upon a time, and having had the need to access health care in South America, and having had need to access the healthcare systems in Europe when I lived there for 4 years, I can say that absolutely the American healthcare system is the most readily accessible, is by far the best emergency care system that exists on the face of this
In
planet.
Europe.
Now, I want to say I'm confident that if I had no health care at all, I mean no insurance at all, I would be taken care of. I have that kind of confidence in the system that currently exists. Now, what we want to do is improve that to give more access. And I believe that there are people out there who lack, to some degree, access. Consider Native Americans and consider
And
Hispanics who live out in the prairie.
well, let's talk about
Now,
Native Americans for just a second.
Well, let me finish my
Okay,
point first. Now, those people live quite a ways from expressways, quite a ways from hospitals and stuff like that. There's the access problem. But people who live close around me, we have ambulances, we have all kind of health care. And there's nobody who would get a broken leg right now at this moment who wouldn't be carried to the hospital by an ambulance and be treated.
The difference between having accessibility to treatment in a healthcare facility and having health care that's affordable is different, because anyone can be transported in an ambulance and anyone can go to a local hospital. But when you leave, you may be filing bankruptcy. When you leave, you may not have the adequate drugs because you didn't have the necessary insurance.
Now that's
So
where
when you-
healthcare breaks down.
Absolutely. So when we talk about healthcare, we need to begin to look at the accessibility and the insurance options, because what we have now is simply access. Who doesn't have access? Like I said, you have access to the public transportation system, but do you have the money to ride? And that's the critical question that we need to be asking. And to trivialize this to a particular ethnic group or particular citizen or group A, group B, and then try to make a point to say that these individuals may have a better system or a lesser system is trivial. We need to focus on why reform is necessary and create affordable, quality health care and provide stability and security for citizens. We are Americans. Why shouldn't we have health care not just accessible, but have the affordable options or the security? You see, if I am going to the hospital to have a transplant and I'm worried about how much the drugs are going to cost, because when I get out, I'm going to need some drugs to continue to stabilize me. But if I can't afford them, because the drugs are, the surgery, first of all, the transplant maybe was $500,000. The drugs itself could have been $20,000 a month. Now, who's going to get that for me?
Well, and
Not even rich people can have that.
Absolutely.
Okay,
yeah,
go ahead,
you know,
Fred.
if people want to have, the kind of healthcare that we all want, someone, somewhere, some way, somehow has to pay for it.
Absolutely.
And now we all agree that we want to buy that big Cadillac. We all agree that we want that absolutely silver-plated luxury ride. And then we go down and we settle for the Chevrolet store. Now, is the Chevrolet a bad car? Is the Chevrolet something that doesn't have all the nice little bells and whistles like the president's healthcare plan does? Well, okay, but none of us have the healthcare program that the president does. Should we all have that same level of care? Because that's kind of what we all aspire to. And we need to take a step back from that and say that, well, should the president have better health care than the rest of us? And the answer should be no, absolutely not. He's a citizen of this country just like everyone else. Right. We need to agree upon a level of health insurance that provides a level of health care, as Mr. Dix is defining it,
accessibility.
That is a commonly, societally acceptable level. Each and every individual is going to have their own individual story.
But you just skewed that argument again. You're back in commingling healthcare with insurance. We got to keep those separated. All of us here have health insurance.
Okay.
Because that's by an employer.
Sure.
Health insurance is provided by an employer.
Yeah.
Health care under Medicaid and Medicare, which is a government-funded insurance program,
Sure.
is provided by the federal government. And everybody has it.
Government
It's
run.
provided by the three people in this room and our taxes.
Absolutely.
Let's make sure this federal government paying for something is nonsense. We are the government. We are the payers. We are the
We the
funders
people.
of that program.
We the people.
But I don't know where you're going with that point there. Obviously, everybody pays into the tax system that supports Medicaid, Medicare, but we need to make sure that we keep insurance and health care, as we view it, separated entities.
Why?
Because most people in Congress and most people who discuss health care don't know the difference between health care and insurance. And that skews the argument. What we don't need people to have insurance. We need people, there aren't enough employers anymore.
I think
we need to have people with health care.
I think that's a false choice, and here's why.
Okay.
To have a shoe and not to have a leg to put it on, it's something different. And let me clarify something.
I hate to ask you to elaborate upon that.
Yeah,
some other time.
You're right. But the point that I make here is that they go hand in hand, and the point is that we need to have accessibility, which we do, but now we need affordability and equality, stability, and security. And one way to do that is to require Americans to have health insurance, just as we require individuals to have car insurance. Now, here in America, we have to have car insurance to drive our car, but many who have cars don't have insurance. Now, for those who try to drive a vehicle without car insurance, you're going to get penalized. You mean to tell me the property is worth more than your body? That's ridiculous. And we have to begin to rethink how we are been trained. We've been trained to understand that it's okay to have we have to have car insurance because we have license to drive a car. But we don't have any health insurance. So you can have a car and car insurance to drive to a local hospital that is accessible to everyone. But when you get treated, you don't have any money to pay for the treatment. And what we're looking at here is costs. We have aspirins that are $250. I mean, who are paying for that? These are people who are trying to get rich. And rich getting richer and richer, and the poor is getting poorer and poorer. And then America say, well, that's okay. That's the American way. That's not the way I see things. I think everyone should be entitled to have health care and insurance. We should have both.
Well, the insurance is always defined as those benefits that are provided by an employer. Now, who would pay for this insurance? Do you know how much insurance would cost an individual today?
Well, sure. If it's Blue Cross, it's about $400 or $500 a month. That's very high, especially in an economy that is really have been in the dumps.
Who would pay for that?
Well, the citizens. We're the same ones who are paying for health care when individuals who don't have health care go to the hospital to get treatment.
Okay, now this Blue Cross Blue Shield system you're talking about, I'd like to know what system that is, because I have Blue Cross Blue Shield system that I'm paying for myself, not through any employer. Okay, and it's a little bit more than $400 to $500 a month.
Yeah.
Oh,
now,
very good.
Thank you. Now,
very good.
Now, at the second time, I also want to hear the story of this $250 aspirin. That's got to be one heck of an aspirin. I hope it has a lot more than a normal aspirin.
Yeah.
But we're talking here. The question that Henry asked is who's going to pay. So everybody is entitled, and okay, I'd like to know the basis of why you think that you're entitled to health insurance. But before that answer comes forth, this is going to be an enormously expensive program. There's no reason to think that this public option that Mr. Dix has been talking about is anything other than a down the road government takeover, federally funded, single payer, healthcare system that is going to skyrocket costs, that is going to skyrocket fraud, and that is going to make sure that no one has any control of what their own health care costs are, because they're no longer responsible for it, because now we're back to it's the government's money.
Just like
nobody
Medicare.
pays for it.
Just like Medicare.
And as I said earlier,
that's government run.
And Medicare is going to be 100% of the federal budget by 2050. Now, we need to have a long and careful discussion about Medicare, but we don't need to have it today. While we're having the discussion of how do we provide health insurance, to the 8 to 10 million people who are not covered by any one of a number of federal programs today. These are individuals that we do need to help.
Right.
They're our neighbors. They're our
Gentlemen,
friends.
we've got to bring the show to a close very shortly, but I want to ask you again, what would you say to public policy people who confuse health care with insurance? That debate doesn't carry us anyplace because people get very upset over.
Healthcare is clearly having access to a facility that provides treatment. Insurance is when you have the some payer or employer-based pay system that allows you to use this as you pay into it, or Medicaid, which is government-run like Medicare. That's having insurance. See, the problem is not just having access. The problem is paying for it. Now, we have lobbyists from the insurance industry that paid in last year $3 billion over 3 years. $3 billion over 3 years to prevent reform. These are insurance giants who are saying, hey, we don't want you to change the system because we are making money.
And I'm
No,
going to
you
disagree
say-
with that. You know, the insurance companies have said that yes, there's some reform that's needed. Here's some reform we need. Now, I don't 100% agree with them by any stretch of imagination, but this whole concept that there's a large number of people saying no is absolutely wrong.
Right. Eliminate extra charges for preventive care like flu shot, diabetes, tests for mammograms, and we're going to protect the Medicare for seniors. And I think this administration is doing a great job in doing that. And we need to move in this direction. And if we don't have a single vote for the
Gentlemen,
Republicans, we
at
need
this
to vote
time,
against
we
it.
must bring
Vote
the
for
show
it.
to a close. But first, I want to thank my guest, and then I want to thank the audience for viewing this show today. Until next time, stay focused.